Welcome to this video on why talk about alternatives for ADD and ADHD. And this is video number 1 on alternatives for ADHD by myself, Dr. Kenny Handelman. Just to tell you a little bit about myself, I'm a child, adolescent, and adult psychiatrist. I'm board certified in the US as well as Canada. I'm an expert in ADD and ADHD. And my mission is to make sure that you have the right information that you need to make informed healthcare choices about ADD and ADHD. Let's face it, there are so many misconceptions out there, so much misinformation, and I really want to make sure that you can have the facts that you need to make the right healthcare choices for yourself. And this may mean talking about things like alternatives that your doctor or healthcare professional may not know enough about. Now, why should we talk about alternatives? A very good research study has documented that 66% of parents of a child or teen with ADHD have tried some kind of alternative treatment. That's 2/3. Interestingly, only about 11% of those people have told their doctor about it. So doctors, who are supposed to be the main sort of healthcare provider, ideally, and they're often the ones covered by your insurance plan and whatnot, oftentimes doctors don't even know what's going on. And I have to admit, when I read about this, I was thinking, well, no, it's not that many of my patients who see it, who use alternatives. But then I started asking the questions. And in fact, about 2/3 of the families I work with were using some form of alternative treatments. But until I started asking the questions, they weren't telling me those statistics were accurate, even in my practice. Now, when we think about ADHD, I mean, ADHD has a lot involved in getting the diagnosis and creating a treatment plan. And what I hear a lot is that the ADHD treatment plan often consists of this: medication. Unfortunately, in many communities, in many doctors' offices and healthcare facilities, people just get prescriptions for their ADHD. They don't necessarily get what they truly need, which is a comprehensive treatment plan. Now, a comprehensive treatment plan, or what's often called multimodal treatment, should include some form of behavioral treatment, counseling or therapy for kids and teens, parent management training, academic strategies, potentially coaching, and I'm going to suggest alternative treatments as well. And I feel that it's important you have the right facts so that you can use alternative treatments knowing what the research is and be able to educate your family members, your doctors, your healthcare professionals about the alternatives as well. So my perspective is that alternatives do play a role in a comprehensive treatment plan for ADHD. Now, when we look at alternative treatments, it's important to be aware of some guiding principles, like how do you choose which alternatives are reasonable to try? So here are a few steps for you to consider. First of all, education is critical. I'm glad you're watching this video. And as you notice, this is video number 1. We will have another couple of videos that will give you more information about alternatives. So education is critical. Watch these videos, read some books, get more information so that you can have the facts that you need to decide if the alternative treatments we're talking about here will be helpful in your situation. Secondly, you need to know the issues of safety when choosing an alternative treatment. And one could say that there are different levels of evidence needed to make a choice. So what I mean by this is, if I were going to recommend that you should take a multivitamin to improve ADHD treatment, you don't probably necessarily need major randomized double-blind placebo-controlled trials. In other words, you don't need a ton of research to make sure that vitamins will help. Well, it would be nice to know if they helped, but it's probably just a safe thing to do, and it's not going to cause a lot of side effects. Now, if I said that there was an herbal treatment that came out of South America from the Amazon jungle, and there was a chance that it could interrupt kidney functioning or have a big impact on the liver, well, there better be very good research about the fact that the treatment works and also about the safety of the treatment before you even consider using that treatment. So there are different levels of evidence needed to make a choice. Now, there are some treatments that may just have side effects that are not going to impact you physically. So what I mean by that is every treatment has some kind of side effect. if you're going to go do something like neurofeedback, where you're not actually ingesting anything and nothing's going into your body, but if you go through that brain training process, and we'll talk a little bit about that in the third video in this series, if you go for neurofeedback, the biggest side effects are really time and cost, because you have to go to the center at least once a week, if not twice or 3 times a week, plus you have to pay for the treatment, and it takes quite a lot of time. So there is a side effect there. Now, if you're taking an herbal preparation, the side effect may be interaction with other medications or having an impact on some critical organs like liver or kidneys. So you need to think about and look for research and evidence about the evidence that the medicine works or the treatment works, and also for evidence about the safety of it. And that can help you to choose whether it's okay to go ahead and try it, even if there isn't as much evidence as you would like to see. The third point here is to look for real research, not just testimonials. There are a number of sites on the internet where you can go and find an excellent written web page all about how helpful such and such a remedy is to treat ADHD. And there will be stories from mums and dads saying their kid is so improved, or adults talking about how their life is so much better. And that's marketing testimonials. That does not equal research. Even if something is published as a case cohort series, a series of cases that are reviewed and published in the medical literature, that has more validity than just a testimonial. So look for real research. Ideally, it's some form of controlled trial. And we can talk more about that as well. So look for real research, not just testimonials. And you need to monitor the effectiveness of treatments. It doesn't matter to me whether you're taking Concerta or Adderall or a medicine for ADHD, or whether you're trying diet change, omega-3 fatty acids, neurofeedback, or any other treatment. It's critically important that you measure the level of symptoms at the start of treatment and then monitor the response to treatment over time. And that's really important to know if the treatment's working or not. First of all, if the omega-3 fatty acids or other alternatives are working, the fact that you've tracked it will prove that to the school and the doctor, even if the doctor is skeptical. Now, if these treatments aren't working, then you're going to need to adjust the treatment, because there are some long-term risks with ADHD if you do not get effective treatment. So you need to remember that there are potentially long-term risks if you don't get effective treatment. So you need to monitor the outcome of the treatment, hopefully in cooperation with your doctor, whether you're doing diet change or medications. So this concludes video number 1. Thank you for watching. At the website www.alternativesforadhd.com, we will soon have more information to help you learn about alternatives for ADD and ADHD, and we will have a couple more videos coming out shortly. Thanks for watching. This is Dr. Kenny Handelman. Bye-bye.